Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. We're going to be speaking with Dr. Barbara Giacomelli this morning, Vice President of Advisory Services at McKesson RxO. She's joining us to talk about the critical role that technology plays in pharmacy operations, particularly regarding drug therapy oversight for patients, as well as the need to safeguard against cyber attacks. Welcome to Health Professional Radio, Dr. Giacomelli. Thank you for joining us this morning.
Thank you for having me.
Well, give our listeners a bit of your professional background. Of course, I mentioned your position there at McKesson.
Sure. I graduated from pharmacy school quite a while ago and started my career through a pharmacy residency sponsored by the American Society of Health System Pharmacists. And really that has led me to a career path in health systems. I've worked in community hospitals. I've worked in management and leadership roles in health systems in the Philadelphia, South Jersey area. I've also been a vice president of clinical services, and another position I held along with being a director of pharmacy was director of strategic planning for the organization. So I've kind of had a varied career. I joined McKesson about 10 years ago after being a customer, actually, for almost 15 years. So in my role today, I work as a consultant and I lead a team of consultants within what's called pharmacy optimization at McKesson. And I also work with our business unit partners and pull in consultants from those teams to also help our health system customers.
So needless to say, you've seen the ups, the downs, the sideways, and all arounds of pharmacy as far as technology is concerned. You've seen it, yeah?
Yes, I've had the opportunity to take pharmacy departments from handwritten profiles to information systems to fully integrated electronic medical records, including use of technology and automation to pharmacists and technicians be more clinically involved in care and let the technology do some of the distribution work.
Have you seen a rise in the efficiency as far as technology in pharmacy operations, or have you seen kind of a breakdown with what's going on now?
I've seen a rise in efficiency. I've seen the reality is that technology and computer systems and software enable the users to do more, to get deeper into what's going on with the patient. I've seen the barriers when it operates in silos, and I've seen it advance to be able to be more integrated and work across different platforms, which is critical. With each step, it's just like raising a child. Each stage has its ups and its downs. So, the challenges today are with all the data and information and the cost, because it doesn't come without a price. It can be quite expensive for organizations to implement these state-of-the-art technologies. You then have new challenges. How do you manage all this data? What does it all mean? How do you make sure it's secure and that it works in an efficient manner and it's not taking away what is the value of a healthcare professional, and that's the face-to-face interaction and the connection with the patient. So you can get so caught up in what you're looking at on your computer screen, you have to remember that you're taking care of a patient.
How often does the technology raise a red flag? The pharmacy, I would think, is the last line of defense when it comes to the prescriptions. It's, the doctor prescribes something for this, that, or the other, but because you're the pharmacist and you see the drugs that these patients are on, does the technology often red flag and say, hey, maybe we ought to rethink this?
Red flags are often, alerts come through. They could tell you that, this patient's insurance is not going to cover the cost of this therapy, or they can alert you that there's a drug interaction that the provider might not have been aware of because maybe he or she specializes in one area and this patient may have seen multiple providers for different reasons. So I agree with you. The pharmacist and the pharmacy really is that last step to the patient. The patient has a responsibility to understand what they're taking and why, but as there's many drugs out there. They're very complex, potential for interactions and side effects. and aging population, people who can't read as well or don't really understand or haven't really fully comprehended what their providers told them. So the pharmacist is a critical role and is very important in the healthcare process.
Speak to the difficulty of managing all of that data and securing it at the same time.
So that's a challenge. And when we meet with our customers and talk to them about what they're facing every day, it always comes up. How do I manage my data? How do I use the data to, the best of my ability to provide care for the patient or, plan strategically what's next for my organization or how I can do better. And so that is an area that's always asked about. Data comes in from multiple sources. Even when you have a fully integrated electronic medical record, there's still other pieces that are coming in and touching that. It's not one comprehensive system, so it needs to talk to each other. And you have to have security all along the way, because what you don't want is someone's private health information getting in the wrong hands or their personal information. In these systems, they contain quite a bit of information about a patient and their personal information. So you need to be secure and you need to have access. So that's always a concern with cybersecurity, is the fact that what if the system breaks down or there's a major storm or someone hacks into the system? How do you keep operating and having the information that you need to do your job and yet make sure it's secure? Because if a computer system goes down, it really can hinder you and your ability to provide care.
Talk about some of the ways that, the leaders in a facility can, prepare or at least address some of these cyber attacks, these potential cyber attacks.
So IT, obviously the Information Systems Department is a critical one in a healthcare organization, and they spend a fair amount of their time making sure the system's secure, that there's redundancies, so there's a backup to a backup, and that they have it controlled in a way that people just can't access. So you have to make sure that someone can get to, a healthcare professional get to the information they need, but you also have to maintain security of the system. So that's rather complex, and that's what they focus on all the time. From a healthcare leadership perspective, that's a significant part of an organizational budget. But then you also have to prepare and have discussions and, almost like emergency preparedness. Be prepared. What are the steps that will occur if there's a failure or if there's a cyber attack? What will the position be? Some organizations have been in a position where they have to pay a ransom to get access to that information.
Absolutely.
Others have made the decision not to. So they have to be prepared. What will that impact them if it should occur? How will it impact them?
We'd like to learn some more about McKesson. Where can we go and learn more about your organization as well as the cybersecurity issues that we've been talking about this morning?
Sure. We have a website, www.mckesson.com. It will lead you to different areas of McKesson. McKesson is a global company, and there are many different business units that either work in health systems or retail, med surg, but all of it is related to healthcare and providing care to the patient. So as far as you'll be able to find some articles on cybersecurity, our IT department, like many others in organizations, are behind the scenes. That's a group that's very critical to an organization, and they're always behind us, working with us. I'd say one of the challenges healthcare organizations face today is, prioritizing all of the technology and software and IT projects, and McKesson is no different. So, we're constantly looking at how to be better and meet our customers' needs and also maintain secure systems so our customers are confident that whatever information they've shared with us is confidential.
Well, I appreciate you joining us here on Health Professional Radio, hoping we can speak again. Thank you so much, Dr. Giacomelli.
Thank you for having me today.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Barbara Giacomelli, Vice President of Advisory Services at McKesson. She's been here with us talking about safeguarding against cyber attacks. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download a SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.